Hi guys, welcome to the Toothfairy channel. Today we're going to talk about gingivitis. Most people that have gingivitis do not know that they have gingivitis. So if you have red tissues, puffy tissues, if you have tenderness, if you bleed when you floss, if you bleed when you brush, you, my friend, might have gingivitis. But not to worry, today we'll learn all ins and outs of gingivitis, how to prevent it, how to fix it, and symptoms. So stay tuned. According to the CDC, half of the adults of 30 years or above have some sort of gum disease, either gingivitis or some sort of periodontitis. The biggest difference is gingivitis is reversible, where periodontitis is actually not reversible. If you have gingivitis, gingivitis is pretty much a fancy name to say that you have inflammation of your gum tissues. However, gingivitis does not discriminate. You can get it from being a child, you can get it as a teenager, you can even get it as an adult, and the older you get, the more chances you have of having some sort of gum disease. Gingivitis is a type of periodontal disease. If you have gingivitis, it means that you might have some bleeding, some tenderness, and some redness in your tissues. Some reasons why you can have gingivitis could be a systemic condition, such as HIV, diabetes, or cancer. However, the number one reason why people actually have gingivitis is because they have poor oral hygiene. So today, I'm going to teach you ways that you can minimize your chances of getting gingivitis, and if you do have gingivitis, how you can fix it. There are thousands of cases that are diagnosed every year of gingivitis. There's some risk factors. Risk factors could be number one, poor oral care. It could be smoking, dry mouth, systemic diseases, poor nutrition, or hormonal changes. Hormonal changes is like pregnancy. So there's actually such a thing as pregnancy gingivitis. Okay, let's take a moment to talk about periodontal measurements. With the periodontal measurements, they use a periodontal probe. This is what it looks like. And they put it under the gum tissue. The reason why they do this is to measure if you have any bone loss. They use a dental probe, go under the gum tissue all the way to the base of the pocket. So if you can see here, it will go just like this and under the gum tissue, like this. That's why it's a little bit uncomfortable. If you get numbers that are 1 to 3, that's really good. But if you get a number that's a 4 millimeter, that means you have inflammation. And that is an indicator of gingivitis. However, if you have anything more than 4 millimeters, like a 5 millimeter or 6 millimeter pockets, that means that you probably have bone loss and then you might have some periodontitis instead of gingivitis. Gingivitis means that you don't have any bone loss, just inflammation. So whenever they do this and check your pocket depths, that means that you might have a 4 millimeter pocket. The good news is that gingivitis is completely reversible. You just have to make some changes at home. Number one, make sure that you visit the dental office at least twice a year and do your professional dental cleaning. Make sure that you get into a routine. The first thing is you must brush at least twice a day. And if you can, brush at least after every meal or after every snack. Make sure that if you use a manual toothbrush, make sure that you look up here. Because for some reason they sell medium bristle toothbrush, but those are not good for you. So look up here because you want to look for something that is soft, not medium, not hard. A soft bristle brush is what you're looking for. Also, make sure that you change your toothbrush every 3 months. If you can, it is best to use an electric toothbrush. The reason why is it actually spins more and it's actually more effective on removing biofilm or what you will call plaque. If you're able to get an electric toothbrush, it will be a better option for you. Another thing to add to your daily routine is flossing. Not sometimes, but every single day. There's a lot of people that do not floss every day. I don't know why. To me, not flossing is like taking a shower and never washing your hair. Because when you actually brush your teeth, it does not go in between your teeth. So you must floss every day to prevent gingivitis. If you have gingivitis, you may want to try the Frescom detoxified toothpaste. It's actually a great toothpaste. It has stannous fluoride, and it actually is very foamy, so it penetrates the tissues up to 4 millimeters. So if you have gingivitis, this would be a great option. If you have gingivitis and you're a smoker, then I'm sorry to tell you that smoking actually contributes to periodontal disease. So if you have gingivitis and you want to get better, I'm sorry, but you must stop smoking or at least minimize it. You can always try the nicotine patch if that helps, but smoking definitely does contribute to gingivitis and periodontal disease overall. If you found that this video was useful and valuable, I encourage you to like it, share it, and write a comment because I always answer. Also, I encourage you to subscribe because like that you will be notified every time that I upload a video. Full disclosure, I am not sponsored by any company. These are just my opinion and I just want to share my experiences. Also, stay tuned for next week's video. Next week, we'll be talking about periodontitis and you'll learn what the difference is between gingivitis and periodontitis. Thank you so much for watching the Tooth Fairy. Until next time.